Hi, my name is Silpa and my MPH concentration is Environmental and Occupational Health. I'm also my final year of training as an occupational medicine resident. Over the past few years, my research focus has been on deployment-related respiratory disease in military and civilian deployers returning from Southwest Asia locations, such as Iraq and Afghanistan. The title of my research study is The Utility of the Lung Clearance Index as a Non-Invasive Marker of Deployment Lung Disease. The purpose of the study is to learn more about new, non-invasive ways of detecting lung disease in U.S. military personnel and people who worked as contractors during military operations in Southwest Asia. Now I'm going to provide some background about Southwest Asia deployment lung disease and why there's need for this particular research project. Since 2003, over 2.8 million United States military personnel and civilian contractors have deployed to Southwest Asia. Deployment to these regions is associated with exposure to potentially hazardous complex inhalational mixtures, including burn pit combustion products, desert dust particulate matter, explosive blast, local polluting industries, and microbial bioaerosols. Deployers have returned with respiratory symptoms of shortness of breath unexplained by traditional diagnostic testing, such as something called pulmonary function testing and chest computerized tomography, also known as CT scans. These individuals may be at risk for a small airways disease known as bronchiolitis that may only be detected on lung biopsy. The Lung Clearance Index, or LCI test, has shown promise as a non-invasive marker of small airways abnormalities and other lung diseases such as cystic fibrosis. LCI scores of 7 or less are thought to be normal, while higher scores may indicate lung disease. I've hypothesized that LCI will provide a useful early marker of lung injury that will correlate with and predict abnormalities found on lung biopsy better than traditional pulmonary function testing or CAT scan. I have two specific aims. The first is to determine the utility and sensitivity of LCI as a marker of lung injury in deployers with unexplained respiratory symptoms compared to non-deployed adults who have been matched for age and smoking status. The second aim is to examine the correlation between LCI score and the clinical characteristics of deployers. Inclusion criteria for the study include enrolling participants with a history of military deployment or work as a contractor in Southwest Asia between 2003 through present. Deployers have been recruited from the Occupational and Environmental Medicine Clinic at National Jewish Health. Healthy adults who are not pregnant and have no history of pre-existing lung disease or previous deployment to Southwest Asia are being asked to participate in the study to provide test results for a normal group that will be compared to participants with known deployment-related lung disease or symptoms. I'm currently wrapping up testing and have completed testing on 19 controls and 18 deployers with a plan to have a total of 40 participants. In terms of anticipated results and implications of this project, I expect that the mean LCI will be higher in symptomatic deployers with abnormal lung biopsies than in adult matched controls. I also expect that LCI will be more sensitive than pulmonary function testing and chest CT in detecting deployment lung disease based on the lung biopsy data that we have available. This could have huge implications in the sense that LCI, if a sensitive marker, could actually prevent people from needing a more invasive diagnostic test such as a lung biopsy. Finally, just in terms of the last part of the intro video, if I could transport myself and go anywhere I wanted for 2 days, I would choose to go to Nantucket, Massachusetts. I absolutely love the ocean and the serene atmosphere on Nantucket. I think of it as the ultimate place to go for rest and relaxation.